Today we're here in Leeds welcoming over 200 people from different organisations in health, public health and social care, looking at national intelligence and local leadership.
I think there's a real value in bringing people together to discuss workforce issues, particularly at the current time when there's so much talk about integration. We've been talking about integrated commissioning and integrated delivery, but actually we've got to think about the workforce that we've got to bring together in order to make that happen.
For many years now, for the last 10, 15, 20 years, I think it's been a guessing game. How many doctors do we need? How many nurses do we need? And sometimes we're lucky, we match. A lot of times we're not that lucky and we have too many of one, not enough of the other. So we need to, the centre I think is taking a much more systematic, analytical approach to it all, and I think it's absolutely essential given the changes in the demographics that we have in society. So we need to match needs with the skills at the right time, really to ensure that our societies are sustainable.
We're in a state of major change, what's called the VUCA world, volatile, uncertain, complex and ambiguous. And the reason for a conference now is to understand how we might make the best of the new system in health and social care.
There are a number of challenges that it's useful to discuss at an event like today. One is around the major changes that are taking place in the system around education and training, and how we use that as an opportunity to focus on improving the quality of care for our patients.
If we are looking at bringing workforce together and they've got a horizon scanning tool, the new portal that you've put in place, it's something that really could be helpful to people as they think about how to go about planning for an integrated workforce.
I think what workforce planning does is makes you stop and think about what you want in the future. So to me it's not as much about workforce planning, it's about thinking about what do we want in the future and then reflect the kind of people we want to attract, the kind of training and development we want to do and the kind of standing we want to give them in society.
The Centre for Workforce Intelligence is a listening organisation, and so one of the major purposes of our conferences is to hear what people have to say about what they think we should be doing next. And we gather up suggestions, usually over 250 at each of our events, and then we work carefully to categorise those and look at the programme for next year.
I think the value that the Centre can bring to the system at the moment particularly is to take a huge amount of information and data and create some useful intelligence for employers in the service to consider their workforce, both in terms of the current workforce and the workforce of the future.
It's really good to see people sitting down together and trying to work through problems, and actually to have health colleagues raising the issue of integration with social care and social care colleagues asking how they can support the health service. It's a healthy approach and it's one that we'll need much more of as we move forward.
It's been interesting that there's been an honesty here about the challenges we face, but also a lot of excitement and enthusiasm about how we could make it different.
The value that this kind of event can bring to the system is first of all to bring together 200 people from different areas of the country, different organisations and different levels in those organisations, and they can share, network and get all of the good kind of stuff that can come out of our workshops, our keynotes, but more importantly they can help us take the agenda forward together by contributing on the day and afterwards on our website.
I think the conference really brings together a range of people with real expertise and leadership responsibility at local, regional, national level to share problems, opportunities, work together on solutions and actually really lead the system forward for the benefit of people using services.
I'm delighted to be at the conference to see that you're discussing issues of integration between health and social care, but it's a big challenge and it will take time.
I've really enjoyed the day today. It's been very interesting to hear the high-level strategic issues around workforce development, particularly around social care, and obviously the need for quality leadership in adult social care.
So here we are at Leeds and we've had a wonderful day with over 200 people working together and networking, and this has been the culmination of 2 events with a total of 430 guests, and we look forward to welcoming you back next year, and we'll take forward all the results of these conferences, put them up to the website and work with you to get things moving.